today I presented data on the first study ever on a medication called Venetoclax. Venetoclax is a BCL2 inhibitor. It's already approved in the United States for another common condition called chronic lymphocytic leukemia. And we had some laboratory data showing that this pathway called BCL2 was actually overexpressed in patients with Waldenström Macroglobulinemia. So, and we had some laboratory data also that showed that this agent, specifically Venetoclax, was very effective on eliminating those malignant cells. So we ran a study. We accrued about 30 patients on this study. And basically what presented today was the results of that. I showed that in patients who were previously treated and the disease was coming back and they needed to be treated again, Venetoclax actually induced a response very close to 90%. That means that 9 out of 10 patients who were exposed to Venetoclax actually had a reduction on their IgM levels and an improvement on their hemoglobin levels. Interestingly as well, their bone marrows showed also a significant decrease on the amount of disease. So with that efficacy comes a very safe profile in terms of adverse events. There were some decreased counts on white blood cells. In about 10% of patients it was severe, but pretty much no concerns with nausea, with vomiting, nobody lost their hair, there was no nerve ending damage, there was no neuropathy, there was no risk so far we know of secondary malignancies, for example, or something that happens in patients with Waldenström's called an IgM flare. So the toxicity profile so far, we have about a year as a median follow-up on the study, has been very benign, very benign.